Welcome to the webinar Improving the Quality Measures, % of long-stay residents who have or have had a catheter inserted and left in their bladder. This webinar is part of a series intended to help nursing homes understand and improve the 13 long-stay measures that are used to calculate the Quality Measure Composite Score. This measure reports the percentage of residents who have had an indwelling catheter in the last 7 days. The numerator for this measure is the number of long-stay residents with a selected target assessment that indicates the use of indwelling catheters. H0-100A is checked. The denominator for this measure is the number of long-stay residents with a selected target assessment, except those with exclusions. There are 4 exclusions for this quality measure. The first exclusion is that the target assessment is an admission assessment. A0310A is coded as 01, or a PPS 5-day assessment, A0310B is coded as 01. The second exclusion is that the target assessment indicates that indwelling catheter status is missing, H0100A is coded as a dash. The third exclusion is that the target assessment indicates neurogenic bladder, I1500 is checked, or neurogenic bladder status is missing, I1500 is coded with a dash. The last exclusion is that the target assessment indicates obstructive uropathy, I1650 is checked, or obstructive uropathy status is missing, I1650 is coded with a dash. To help identify what your team can do to improve this quality measure, refer to the RAI Manual Appendix C to find the care area assessment for urinary incontinence and indwelling catheter. The care area assessment process provides a framework for guiding the review of triggered areas and clarification of a resident's functional status and related causes of impairments. It also provides a basis for additional assessment of potential issues, including related risk factors. The assessment of the causes and contributing factors gives the interdisciplinary team additional information to help them develop a comprehensive plan of care. For each resident who triggers for this quality measure, review the factors that contribute to catheter use, including diseases and conditions. Also review input from the resident and/or the family or representative. Then, analyze your findings, and for each resident, document a description of the problem, the causes and contributing factors for the indwelling catheter, as well as the indwelling catheter risk factors. This information should then be used in the development and implementation of an individualized plan of care for each resident. Implementing quality improvement in your nursing home works best if your home has a culture that supports continuous quality improvement. Please refer to the CMS National Nursing Home Quality Care Collaborative Change Package that offers strategies that your team can implement to develop and enhance your quality culture. One of the strategies of high-performing nursing homes found in the Change Package is to provide exceptional, compassionate clinical care that treats the whole person by striving to prevent problems and treat when necessary. Decreasing the use of indwelling catheters in your nursing home is a great example of this strategy. Please refer to the link on this slide to find other proven strategies to improve the quality culture within your nursing home. Refer to the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure Users Manual for more information about the quality measures. To clarify questions about the MDS and/or quality measures, contact your state RAI coordinator. For further information about the quality measures or about the Nursing Home Quality Care Collaborative, please contact your state Lake Superior Quality Innovation Network lead listed on this slide. Be sure to check out our short videos on each of the 13 quality measures that make up the composite score. Viewing the videos for each of the measures will help your team understand how each measure is calculated and will offer suggestions on first steps to improve each quality measure. Thank you.